Well, I know who I'm going to vote for president. That's great. How about everyone else? Don't know much about them. Probably will leave them blank or pick random people.
Don't do that. Vote the ticket. Down ballot.
Why? What does it matter?
Start a wave. Wash out 2020 and start with a fresh 2021.
Wash out 2020? Sounds good to me. I'll vote down ballot.
Yeah, use your power so I can use mine when I turn 18. Vote the ticket. Vote down ballot.
Go down the ballot. They won't stop. Vote the ticket. Unless we stop. Go down the ballot. Play the top against the middle, against the bottom. Go down the ballot. Vote the whole ticket. Vote the ticket. Straight down the ballot. Go down the ballot. From the Appalachian Mountains to the valley out in Cali. Vote the ticket. Go down the ballot. The whole ticket. Vote the ticket. Vote the ticket. Go down the ballot. The entire ticket. Vote.
Hey everybody, Assalamu alaikum. Hope you're having a wonderful day. Make sure that you hit the subscribe button and the notify button so you'll know when you're getting new episodes. And we just want to grow this project. I thank you in advance. Without further ado, let's get it rolling. The Shout Out Show.
Assalamu alaikum rahmatullahi barakatuh, everybody. I'm Preacher Miles, host of the S.O.S, the Shout Out Show. Hope you're having an amazing Saturday, because if you're not, you're going to have to wait another 6 days to have another amazing Saturday. That's the way it goes, people. All I'm saying is be thankful, be grateful. A couple notes, people. If it's your first time coming to the show, regular situation, we appreciate you for coming, number one. Number two, click that subscribe button. Number three, if you have something to say, put it in the comment section. Be sure you get your shout outs, because that's a favorite of the show. That is a feature of the show. You get your shout outs. I have to say that. Now, let me go further. If you like the show, click the like button on the way out. That's number one. Number two, we got some stars in the building. We have our shout out show regulars, and I'll give them the shout outs right now. Sister Reed. What's going on, Sister Reed? We got Sister Sultana. And all the way from the UK, we got Sister Rabina. We also have an amazing show lined up. Very often, you hear me say I'm really thankful for my guests. What's going on, Sister Mina? We got Sister Mina in the building, Sister Nama in the building. And I just want to say, often we have guests that come on the show. This is very timely. I'm a person that, I'm in the community, but I also keep an eye on issues in the community and how we react and how we support issues in the community. The sister we bring on, she has been, as I said earlier, very progressive in the idea of healthcare in the Muslim community. And when I say healthcare, I mean community care. Not just I'm a doctor, I'm a nurse. I'm talking about community care. Community care goes beyond the doctor's office. It goes to health prevention and awareness. So I'm not going to do a whole lot of talking today. I'm going to bring her on. I'm just going to give a couple rules for the sister, and then we're going to get into the interview. So brothers and sisters, please, without further ado, welcome to the show. She's an ambassador for the COVID Prevention Network. Also, she was a part of a program that I personally feel like did not get enough love, Rahma, which is reaching out to all HIV Muslims in America, which was an incredible program. And we're going to talk about that as well. Let's welcome to the show, brothers and sisters, Sister Khadijah Abdullah. How are you, sister?
I'm good. Sound like
you got people in the queue already for you.
Oh, okay.
We give people shout outs on the show. We're a little proactive. So you'll be talking. People are going to have some questions for you. They're excited to talk to you. And let me say from the bottom of my heart, thank you for coming on the show.
Thank you for having me.
You're on the shout out show. I haven't done conspiracy theories. I've been close about COVID. I've talked about Tuskegee syphilis experiment and things like that, and just the awareness or the lack of awareness, or just the lack of care around healthcare. So we have some people. I'm gonna introduce you to them. This is Sister Ree. Sister Ree is our craft services. She makes sure that your brother Preacher Moss gets the best in nutrition. Sister Sultana is our consultant producer, and our research department is Sister Rabina, all the way from the UK. She stayed up to 11. She stayed up to 11 just to see you. We got Sister Naima. I mean, we got folks coming all over. They're giving you salams. Sister Amina.
I know Amina.
You know, okay. And we got Sister Ika all the way from Indonesia. You got much love for Sister Amina. You must owe you some money. Man, look.
She's a good sister.
We're going to get out of this box. My first introduction to you was Rahma.
And
I remember seeing a flyer going, you got Sister Ree gonna welcome you to the show. Now it's official.
Sister Ree, I appreciate it.
But Rahma, and as I looked at it, I was like, wait a minute. Because I was like, why is this not getting more coverage? Why is it not getting more love? Why am I getting it? Because I think I'm top tier for information. I'm like, why am I getting this on the rebound? Like, I got a flyer for an event. It had already happened. I don't know why people send flyers for events that already happened. But to be serious, that focus was really important. I'm originally from Washington, D.C. Mm-hmm. So when the HIV/AIDS epidemic came through, it crushed us. Let's just say that. And here I am going, here we are, people of awareness. We're supposed to be the best of, and this thing is not getting the love. I think. Can you talk to us about Rahma and the environment or the sequence of events that led you to found Rahma, please?
Well, it ain't getting no love because of the stigma. I'm gonna keep it real in regards to that, and it's a taboo topic. Oh wow, I'm gonna scream at myself now. So at Rahma, I started Rahma back when I was in college. I studied to be a nurse, and I was working in the hospital part-time, and I met a Muslim man living with AIDS in the hospital. And, he expressed to me the stigma that he faced in his own Muslim community in regards to his status. He didn't feel welcome. He didn't feel loved. And, it really affected me in realizing that in our community, we hardly talk about sex for HIV and AIDS. And, it's an issue. We have Muslims who are positive who don't feel welcome in the community because we, as a community, don't talk about it as much. We don't talk about it. We don't hear about it much in the khutbah. We have problems talking about sex. So it kind of pushed me to start raising awareness on it. So onto my college campus, we organized the first AIDS Awareness Week. And I really realized I had a passion about it. And my friend, 19 years old, became positive. And that really that was it. Okay, changed my major, went to public health. And I moved to DC, and then DC had the highest HIV infection rates in the country. It is comparable to sub-Saharan Africa because the rates are so high. So we had an epidemic in DC, and it was serious. And, in DC, in the DMV area, I met a lot of people who are positive that are Muslim. But people don't know that because they don't disclose their status because of the stigma, or plus it's not anybody's business anyway. But one of the reasons why is because of the stigma. I met a brother out in Maryland who went to the masjid, and he was there serving food at iftar time in Ramadan. And someone knew he was positive, and they disclosed his status, and people were afraid to take food from him because they felt that the same spoon that he touched, if they touched it, they would become positive. And I'm like, really? So this really shows the need on why we need to have this education. So Rahma started, everyone knows, inshallah, that it means mercy in Arabic. And our goal is to raise awareness of HIV and AIDS with the compassion and with mercy. And we have a long way to go. We've been told by some massagists, oh, we don't need this information. It doesn't affect us. And then we have people who are very, very welcoming, especially mashes of color, like Black mashes, because we know it's something that's real. And we've had like Mashed Muhammad, for example, in DC. Alhamdulillah, they're very, very supportive. I've done a couple of workshops there. We had retreats for positive Muslims in DC, and the Imam Talib Sharif came out and spoke to the Muslims and led some sessions. We went to the masjid itself. We spoke after Jummah, and one of our attendees actually disclosed his status in front of everybody. So Jummah was over. People were leaving the masjid, and he just disclosed it, and people like stopped dead in their tracks. It was like, what?
Wow.
They turned back around, and then they sat down and they listened.
That's where I took my shahada.
That's
why I took my shahada. I'm actually Muhammad baby.
And
why? Let me ask you this: why does this stigma continue? I mean, just literally continue to just plague communities. Like the Muslim community is advanced in a lot of ways. In a lot of ways, it's like we're in the Stone Ages. I don't understand like you just gave this example. You just gave the example of the brother who was serving food. I don't understand how we get to a space where we think if someone has HIV, they have absolutely little or no functionality, little or no value. How did that happen?
Well, first of all, people focus on how they became positive. What was you doing? Was you having sex? Was you doing drugs? Were you doing this and that? And they focus so much on that aspect. They're like, well, what was you doing to become positive? And we're like, it doesn't matter what they was doing. What matters is how you be supportive and how can we as a community come together to provide support to our Muslim brothers and sisters and they and them who are positive and allow them a space in the masjid. And, I think that our masjids, they aren't equipped. A lot of them aren't equipped to understand this. Like they have information that's outdated. Like people don't know you can be positive and have children and it can be born negative. People don't know that if you're undetectable, your viral load is so low that you don't even show up on an HIV test as positive. You can have unprotected sex with someone else, they don't become positive. People don't know this stuff. People don't know that you can marry someone else who's not positive. They can stay negative for the rest of your lives if you take care, like if you follow, your medication regimens. People don't know this. People are living long, healthy lives, and HIV can be managed as a chronic illness. They have like diabetes or blood pressure. You take your medicine, it can be managed as a chronic illness. It's not something that is killing people. People are still passing away. I'm not going to say people aren't dying. People are still passing away from different reasons and causes, but with the advanced technology and medication of HIV, people can have the opportunity to live long, healthy lives. I mean, I had a friend who passed away a couple of years ago. He was 30 years old, and he was young, but he also had cancer as well. So, he had all different things going on. And I had a friend, she was born with HIV. She was taking medication all her life. She got tired of taking it. She stopped taking her medication, and slowly her health deteriorated, and she passed away. HIV can have an emotional impact on people, especially when there's stigma involved. Yes. People have become suicidal because they don't have support from their community. People have left Islam because they don't feel safe or loved by their community. And Allah teaches us to have mercy and have compassion to our Muslim brothers and sisters and to all of humanity. So how are we going to turn someone away because of their HIV status? How are we saying things from the minbar that are stigmatizing?
Yeah, I mean, I listened to my father. Actually, he was a deputy director at NIH, National Institutes of Health. And so he would tell me about all this research that was going on and the grants that were going on. And he said, there's one thing that we can't put a grant out for, which was apathy, which was getting people to understand that this is an illness. I mean, one of my heroes in the athletic world died of HIV/AIDS. That was Arthur Ashe. And we looked at him as this giant of a tennis player. It was confirmed he got it through a blood transfusion. But even then, it was like even though you got to do a blood transfusion, it's like, listen, this thing is serious. Like there hasn't been enough of sounding the bells. Like we all lament it when, you had the seminal moment with Magic Johnson.
Mm-hmm.
But he's had a very long, productive life.
Undetectable as well, which is very.
And I'm like, people need to understand that other people can be Magic Johnsons too, and we need to be able to hold them in that kind of esteem. And it's just not happening. We actually have somebody has a comment. Sister Rabina has a comment for you. A friend was mugged and bitten, came positive, but today HIV treatment. So, yeah, like in the UK, you're talking about this thing that happened.
So there's also, so one thing to talk about a lot is HIV criminalization as well. Like, here in the US, some people might be mugged or bitten, and then, they blast the person who might be positive all over the media and like really criminalize them. And there's people fighting against this because, it's put HIV in a negative light. Now we have this medicine called PEP and PrEP. And PEP, so let's say you're exposed to HIV through whatever way you're supposed to. If you take PEP within like 72 hours or less, hopefully it can prevent you from coming positive. But like we've had so many cases where people who are HIV positive are criminalized. And you really can't become positive if you're bitten unless it's so many different ways, unless that happens. Unless blood is drawn, right, from both people, and somehow it happens that way. Like you may have a cut in your mouth and like something like that. Like it's just really hard for that to happen. I'm sorry that happened in this case, but it's very hard for that to happen. We have to like know the ways HIV is transmitted, how it works, so that we can stop criminalizing it. And that's a really big issue here. And people have been put in jail because of certain situations like this. And people are fighting for people who are in jail to get out, to clear their names because of things like this. And HIV, it takes time. Like, it doesn't just pop up like that. Like, it takes time to kind of build in your body to show that it's something that is there. It's like a window for it to happen. But
I just shows at the prisons. I just shows at the prisons, and ironically, a couple of for the Muslim prisoners, and sometimes the general population, but a couple of Muslim prisoners was like, "Hey,
they're positive."
Yeah, they were like, "Hey, is that a problem?" I'm like,
"No,
no, problem for you. It ain't a problem for me. What do you want to do? We can talk. I give you a pound, give you a hug. I don't understand the issue, but again, to your point, just this stigmatism has been out there.
If someone's saliva, you come positive, which is not accurate, or someone spits, or hugs you, or shares the same toilet, or kisses you, it's not accurate. It's really hard for HIV to transmit that way. It really has to be.
What part of? I want to ask this. You don't have to answer it in full, but I'm gonna throw it out here. Well, what ways are some of our religious communities complicit? I mean, we have this whole this personification. Everything's perfect and it's supposed to happen this way, and I'm like, but you're not looking at the reality of the situations. People aren't necessarily living the way you want them to live. You have rules, but those are perfect case scenarios. Just like if somebody's getting married, you're supposed to stay married your whole life. And then, all of a sudden someone's divorced. Oh, stuff a lot.
Getting divorced.
I mean, like, at what point does this stigmatism, particularly from religious communities who are the space, who are supposed to be the bastions of mercy, how are we not, how are we not stepping up to the plate that way? Now, I just don't mean Muslims, Islam. I'm talking about as a whole. How are we not stepping up?
I think in most religions, like, there's a certain set of things we should follow as like what the religion kind of promotes, but no one's perfect. Like, people do what they do. And sometimes in situations where we might be exposed to certain things. But as a community, we need to be merciful, and you need to keep that in our forefront. So if you're a leader, like an imam or faith leader, you should know this. And someone comes to you and tells you they're positive, you should be able to support them and help them and provide resources to them. And if you don't able to do that, you need to learn how to do it. There's so many things out here, especially in the US, that can help you. And you can ask me, I can connect you with people. I work with people across the country, Muslims and non-Muslims, who do this work, organizations, and they do this work to support the community. So it's no excuse on saying, I don't know how to do this and that. Well, find someone that does, because people are going to leave your community. And I was at a really well-known Muslim conference a couple of years ago, and we had a table where we were passing out information about Rahma. We had a survey, we had a donation box, we had pamphlets, and someone came by the table and they said, oh, yeah, I don't know why you're doing this. This doesn't affect us. You know, there's only this one, what they say is there's one country in Africa that only bothers. I was like, what? Like, what world are we living in? It does affect us. And we had a table one time at a masjid here in the DMV area, and we had youth come up to us, you know, trying to seek and trying to get information and trying to get protection. Because people are living their lives the way they want to live it. And while they're doing that, they should have resources to keep themselves safe and healthy. And, you know, so we be able to support that. And as Muslims, we still be merciful and compassionate, because we don't know what anybody does. Everyone sins. Everyone has things going on. And we need to be able to be there for them and not treat them like they're subhuman. Like, we had a brother. I can tell you so many stories. I could be here all night telling you so many stories. But when we have a retreat with positive Muslims, one of the things they say is that they feel like they are at home. They feel like they found a space where they can meet other Muslims that understand, you know, what they're going through, and they're able to support each other. One of the main things they want, like I've heard from people that work with, they want to get married, but they're afraid, like if they're talking to someone, they're afraid to disclose their status at some point, because they're afraid someone might take it and tell the community. And usually, like, the community, and it comes out to the community, and then people are afraid that people will start judging them and like not want to be near them or talk to them. So it's like, this shouldn't be a fear. Like, our community should be available to support people who are positive. So like, it's just one of our main things. And so I'm telling you, so many times I have doors shut in my face, trying to have like a discussion on HIV and AIDS. And, you know, many times I was like, you know what, I'm not doing this anymore. I don't want to do this. But I realized it's not about me. It's about trying to raise awareness. And then you mentioned earlier, you said one of the people you knew had died from HIV and AIDS. So I want to just say this, is that people don't die from HIV or AIDS. You can't die from HIV. It's impossible to die from HIV. HIV can progress to AIDS, and then people die from AIDS complications. They don't die from AIDS itself.
Yeah, right.
So I just wanted to clarify that, because people say, oh, he died from AIDS. No one dies from AIDS. And some people don't even use AIDS anymore. They say only HIV, because AIDS itself can work in stigmatizing as well. So it depends who you talk to and who you're conversing with. But AIDS, like HIV, you know, attacks your healthy cells until your immune system is unable to fight off different infections. So you might die from like pneumonia or something like that, but you aren't, you know, from AIDS. So that's one thing. And you're right, people can be Magic Johnson. I mean, some people don't have access. Like, for example, you know, COVID is happening right now, right? People are losing jobs. People are losing their jobs. They're losing access to healthcare, and they can't get their HIV medication. You know, so this affects us. And now COVID's in the forefront, but all people who are still living with HIV, they're still important, but all the attention is on COVID. So it's so much, it's like they're, you know, some of them are being isolated. You know, some of them don't have access to that care they had before.
We were talking about that before, that with COVID, a lot of people were not really able to access the care they would normally get.
Exactly.
Because of the, you know, because of COVID and the allotment of beds, ICUs, things like that. There did a study. I don't know if it's out yet. I think they were commissioning a study, if you will, to actually look at how many people died because they weren't able to have the normal, if you will, normal access to healthcare, because everything was so focused on COVID. So bringing up COVID for here's the number from last night: 99,321 new infections for COVID. I got a call today while I was out running errands from a well-known imam. I won't say his name, but make dua for the imam. But his wife called me. I actually thought it was him calling me. So I get on, hey, what's going on? And his wife. And I'm like, hey, why are you using this phone? Is his phone cut off? What's going on? You know? And she said, no, I didn't get a chance to call you. He has been in the hospital for 4 days, diagnosed with COVID. He's in his 70s. So just make the dua for him. But
God heal him.
here I am, and I'm like, this is a guy I know. They do food drives. They serve the community. Fifth Ward, Houston. They've been there for years. This is a guy who has been putting in work, and now he has COVID. And you know, and it seems like, and you can correct me if I'm wrong, it just seems like people don't get it until they get it. You know what I mean?
You know, I'm pretty sure everyone on this live, or will see it later, has known someone who's passed from COVID, or knows someone who knows someone who's passed from COVID. Or we're all affected by it. And you know, I think, you know, we've been dealing with this in the US, like we've been hearing about it since March.
Right.
In our homes, told to be quarantined, so on and so forth. And people are getting tired of being in the home. They want to be able to go outside without having to wear a mask and have certain things. But we would have to realize that COVID is still here. Even if we're tired of hearing about it, it's still here. It has not gone anywhere. And we have to be aware now with the flu season coming up that they're saying it might be a second wave. And as you mentioned, the numbers are increasing, right? Yeah. So it's like we have to keep that in mind, keep distancing socially and wearing masks. And it's hard. And like, you know, I work with the COVID Prevention Network. It's also funded by the NIH. So I work with the COVID Prevention Network. And my role is to work with the faith communities. And trying to partner with like imams and faith leaders to kind of lead prevention workshops on COVID. And we all know what we should be doing, right? We should know, right? Because we're all looking at this. But I think all the time we need a reminder, or we need to go in more detail. So like with working with the COVID-19 Prevention Network, I have access to a plethora of resources around COVID. So when I come to a community, I'm able to tailor the presentation to that community and what their needs are. Mm-hmm. So whatever they have questions about, we can tell that. And we work with scientists, work with researchers. We have, you know, I'm not a doctor myself, but we have doctors. I'm a public health professional. So like you ask me like questions that doctors answer, I probably won't answer that for you, but I can bring someone on who can. So we have a really great network. And it's about 7 of us across the US. I'm the only Muslim faith ambassador, but it's good we have someone on the team who's Muslim because our community is affected as well. And just last night, I had a meeting with about 7 imams that are interested in helping to do workshops. They're across the US, some very well-known imams across the US to have these workshops, because we understand they've seen firsthand their community be affected by it. And one of them, you know, he said he went to the hospital and he's seen where doctors didn't even go in the room of the patient because of especially the beginning of the COVID crisis. And, you know, people were dying left and right. He's from New York City. People were dying left and right. And New York has one of the highest rates of COVID. Yeah. Yes. So he's seen it firsthand. So he understands the importance of education and prevention to protect our community. And we know communities of color are some of the most affected communities of COVID.
Why? Well, community colors. We talked about this earlier in the week. I put up a graph, and maybe why are communities of colors affected so disproportionately?
Why do you?
It's not a little. I mean, it's a lot compared to our white brothers and sisters. Mm-hmm. It's a lot, and I just don't understand. It's like, I mean, the numbers are astounding. Mm-hmm. Like, I'm embarrassed that we're getting sickened at this rate. What is it? Is it that we feel the and I'm gonna frame it this way, and I'm gonna get out of your way because you are the healthcare professional. I hear things in my head about COVID, and people try to make a distinction between people getting sick from COVID and people who are dying from COVID. And it's like a weird sports analogy. Like in sports, they say, "Are you hurt? Are you injured?" Because if you're hurt, you can still play, but if you're injured, you can't play. And it seems to be that way with COVID. Are you sick or are you dying? And I'm like, who wants to traverse the difference? Both sides of the spectrum are extremely serious. Where do you think that mindset is coming from?
Well, I will say in the beginning, a lot of us were still learning about COVID. I mean, we still are learning about it, especially in the beginning. And there was so many cases, like for example, in New York, there's so many cases of COVID that they had to really tend to those who were very sick, and they had to kind of make decisions and like, okay, who gets this, who gets that, and but I mean, we're learning more and more as we go, and it's still an ever changing topic. It's still ever changing disease, and we're trying our best to address it. And you asked why are communities of color so affected by it. So of course I'm able to share my answers on that, but I want to hear from people who are watching. Why do you think communities of color are affected the most by COVID? I want people to, from the comments, to share that. And even you, Dr. Preacher Moss, I want you to share your opinion on why you think we're affected. And then we can go more into that discussion, because we know that we are. Like, I'll give you a stat real quick. We're 2.3 times, Black folks are 2.3 times more at risk of dying from COVID than our white counterparts.
I've always felt, and people who are watching, please put your comments up.
See what your thoughts are.
I want to have a question. I mean, I feel like in the Black community, there has never been a large impetus on health in terms of prevention. So we've tried it. We've tried it, but it doesn't last. And sometimes I say it doesn't last because the funding that doesn't continue, or right now there's an all-out war on Obamacare, accessible health care, things like that. And plus the pressure to produce in the Black community and Black families, the financial pressure means that you're willing to risk, in some regards, your health. You're willing to risk your livelihood. You're willing to roll the dice and think, them, not me. There's an old saying my grandfather say, listen, son, if you go into a room full of smokers, expect to come out smelling like smoke. And somehow that logic is somehow lost, that, we're the exception, if you will. And then we've never been the exception. I mean, in economics, what's the rule? If white community gets a cold, we get pneumonia. And it seemed, well, tell the truth. I'm going to say this. When COVID came, the first thing I said was, Black folk going to get wiped out. Latinos going to get wiped out. Native Americans, they're not even talking about Native Americans enough. They're getting absolutely.
Well, we are at the network. We're talking about them. Like, that's one of the Black, Latino, Native Americans. That's our focus. Is those, and Pacific Islander. Those are our focus on the communities. We're the most affected by COVID. And I don't see anyone trying in the comments. So I guess we'll get into it. But we know that we face some racism all the time in our community. Discrimination. Those are some main factors when it comes to COVID. Like, for example, we had a young woman who was very sick. And she felt, she went to the doctor several times. And like you said, in the beginning of the pandemic, we had doctors are trying to determine, okay, who can we bring in these rooms to take care of? And, also people rely on public transport, like buses and subways, metros. And COVID affected the schedules. People weren't able to get to hospitals or doctors because they didn't have the way to get there. Or they were afraid to get into Ubers because they might be afraid to become COVID positive. So if you're living in an area, you don't have your own transportation, you rely on public transport, you're affected. Or people have lost their jobs. So they don't have health insurance. So that also affects being able to go see a doctor. Or people are essential workers and they have to go to work, right? So that way, so they're more exposed to COVID that way because they have to be at the front lines working. And Black and brown folks usually are essential workers, whether they're working in hospitals or driving transportation, or if they're working in areas where they have to be, then they're exposed. And also people have to realize, okay, I have to work. I don't have the luxury of staying at home. I have to feed my family. I have to take care of my house. I have to get money to pay. I don't have it's like income gaps, and there's, wealth. All Black people don't have that wealth. And we have
we had a couple of questions I'm gonna bring up for you. It's interesting you say that. My brother, Johnny Thomas, is on. He's from Milwaukee, Wisconsin. Milwaukee's positivity rate just exploded. Well, the state of Wisconsin exploded. Milwaukee's kind of doing okay. But it was interesting you said that because there's a conspiracy of they're talking almost half the black population in Milwaukee have suspended licenses.
Oh.
And there is a reliance on bus care. And so that was a very great point. Let me bring up a question. Sister Rabina has this one for you. Because melanated people, although they have strong cells, they are compromised due to weak immune systems, i.e. sickle cell, anemia, diabetes, heart disease, etc. How do you feel about that?
So some of the reasons is pre-existing conditions as well. Like, so if we have pre-existing conditions, we're more susceptible to becoming positive because we already have a weakened immune system. So those are some things to think about as well. And then also our community is really affected because of incarceration. You know, that's like a breeding ground because we're so close together. It's just spreading throughout that population. And then a lot of times we don't even think about this, but undocumented. Like, if you don't have documentation, you might be afraid to seek, medical
help. Yeah.
You might be deported back to another country. So it's like, okay, I'm just going to deal with this. And then it could be COVID, and then you're not taking care of yourself, or going to see you're diagnosed, and it can, eventually the symptoms can increase, and you can pass away. So there's so many different factors to think about. And people will say, oh, well, some white folks, they live in areas too where they don't have a car to get somewhere, or they might have lost their jobs, or they might live in a community where, like, some people, like, a lot of times we live in shared housing. Like, you think of Black people live in areas where it's like a lot of us close together in shared housing, or we might have racial people in our houses and our families. So someone said, well, what if some white folks live there too? They can come positive. Yes, they can. But what they have that we don't have is called white privilege.
Okay.
We don't have that, right? So let's say
we don't have that one.
We don't have that one. Let's say someone white and someone Black goes to a hospital, right? They have that privilege of their skin color. So they might have different experiences you might have when it comes to COVID. They can still use that privilege, right? So it's something you have to think about when it comes to our communities. And I see Amina said, yeah, like we mentioned earlier, public transportation. People don't have access to vehicles. They don't have ways to get out of Baltimore to the place they need to get to seek help and care. So you have to keep these factors in mind. We're trying to think about, why is our community most affected? Because we have these things that in place that kind of block us from getting the care that we need to get. So we have to think about these aspects. So one of our goals is to go out in our communities, and we talk about these different things, see how we can help, and see how we can mobilize imams and faith communities to support. Maybe they can give help with ride sharing, or maybe help people get there, or just help with getting food to people who might lost their jobs, not have food. Or I know, like, right now they have an order in place where you can't evict folks from housing, but it's still happening.
Don't be fooled. They actually, I was just reading, there's a law on the books in some places whereby you can have people arrested for not paying their rent. I read that. Instead of going to civil court, they go to criminal court. Make it issue that you did not vacate the premises at a particular time, so you are. Here's a hustle. They give you a warrant. You have to appear in court. When you don't appear in court, then it's failure to appear, and they arrest you. How about that one, Sister? Well, this is something we were talking about before, Sister. Our unofficial researcher on the Shout Out Show. Are we looking at a full lockdown? I don't know.
I mean, I want to predict the future in the U.S., but I feel like we might be. I don't know, but you see the cases are rising, right? You see that it's happening, and that we have to take these precautions. We have to keep practicing what the guidelines are, because COVID is not going away. Like I said before, we're in the perfect season now where it can increase. We have flu season. People have flu and COVID. Oh my God, imagine that. Imagine how that might feel. So, and I know people are like concerned about, vaccines, right? People are concerned about that. Like,
I don't think people really understand how vaccines work. Like certain politicians who shall remain nameless put it out like you can just get a vaccine next week. I'm like, dude, there are trials. I mean, AstraZeneca down in Brazil, stop the trial because somebody died. You cannot continue
Well,
doing
network,
trial.
with the network, one of our things that we do have vaccine trials, and people have not died from the trial. Like they really look through to see what the different reasons are. What someone has passed away, but it was through the vaccine or something else. And
Right.
people with the vaccine trials, is all voluntary. You can, leave whenever you want to. You're not injected with the actual COVID strain. People ask that, oh, why are we injected with COVID? No, you're not. That's called, we don't do that here in the US. It actually happens, I think, in the UK based on our research, but it doesn't happen here in the US. It's called a different type of study. So we don't inject you with the actual COVID strain. And, we answer a lot of questions. We'll walk you through the process. And people are like, well, I don't want to, get a vaccine because it's Tuskegee, for example, right? Because we all had that experience with Tuskegee and what happened to our Black men with syphilis.
Absolutely.
And, yeah, so we understand there's a mistrust in the community for sure, but we are very transparent and very open about the process because think about this. If we have a vaccine that's only been tested on white folks, how are you going to know it's going to work for us? Right? We have to make sure that we test that is used on every single population. So when the vaccine comes out, we know it's effective on everyone.
Right.
So
right. My father told me a lot about the trials and stuff they did with kidney and lungs and stuff like that, diabetes. He and I would talk.
Diabetes. If you didn't do trials, how would we have insulin? We have to figure these things because trials are happening.
Oddly, it's a lot of people. Big shout out to brother Reggie. Get better. He's fighting that with diabetes. COVID. And I was talking. COVID is diabetes is like a multi failure organ disease. This could go bad. This could go bad. This could go bad. COVID has the same characteristics. It could, and I think something, and maybe you could speak to this. Because we talked about this before. People aren't really talking about once you get over COVID, what's that quality of life afterwards?
I think it's so new. It's so new to us that we have to study it and see what quality of life is after it. Some people, I've met people that have had COVID and they have healed and they seem fine, right? But I think it takes time to kind of study and see what happens. I know someone had COVID twice. Really? People are asking oh, well, now you have COVID, so you have antibodies, but we don't know that. How long they last for. It's those things that we're researching and trying to figure out. But I know one person who had COVID twice. And so you have to think, because you had a COVID once, you're done. No, you still have to take precautions. You still got to social distance. You got to wear your mask. You can become positive for COVID again. It's not one and done. So we have to think about all these different aspects when it comes to COVID, and making sure that we stay healthy, keep washing your hands, obviously all the things that we hear on the news over and over and over again. I know folks are getting COVID fatigue. I understand that, but I'd rather have fatigue than pass away.
Well, people getting COVID fatigue because we haven't done what needs to be done to effectively confront it. So the fatigue is out of the window. We have COVID failure to address what needs to happen. I mean, a lot of us have adult parents that are older. It's what's the scope now for protecting them? I will be honest with you. I thought maybe we might have a dip in COVID, and it would reflect, and we can at least our elders, if you will, can have a little bit of normalcy. Yeah. But it's been a full court press. Mama, you can't go outside. Right?
And I said people want to go outside, and that's what the issue is. People are going outside, they're not masking up, they're not distancing. You see over news people doing different things, and it's increasing the COVID rates. We can't have a normalcy if we don't follow, the guidelines and work towards preventing COVID. And I mean, the main course of prevention, obviously, we having a vaccine at some point. But that takes time, right? So right now, we have to focus on what we can do to keep ourselves healthy and being up to date on information. And, we're going to like the network, for example, coming to us, for example, because we have up to date information about COVID, what's happening in the trials, what's going on. And we can do a whole webinar with your community about that. So you're very aware. We can bring on a doctor or a scientist or a researcher to come on as well and have discussion with you. So you're very aware of what's going on in your community, how it's affecting our community in detail, what you can do about it to keep yourself safe. So
let me ask you this, Sister Khadijah. What is some of the research about how we protect our kids? How we protect the youth, going to classes, being at home. One of the big issues with the Native American community with COVID was the fact that there is a heavy tradition and heritage link between making sure that the children see the elders. That is the infrastructure of Native American life. That information comes from, and the whole idea that these children cannot come around the elders was one of the biggest things they had to battle in the whole aspect of protecting them. Like, you can't come around. We have to disrupt a cultural norm to save their lives, to protect their lives.
I think we're disrupting the whole American cultural norm. Think about it, though, because we are a people that thrives off, the whole humanity, right? We are a people that thrive off human interaction with each other. We have to have that for the most part. So it's disrupting everyone's lives. But we have to figure out what we can do in the meantime to stay alive and stay healthy until we find some type of, vaccine or cure or something for COVID. And you asked about schools. Like, I have a daughter, and when COVID first came out, she was in school every day, and then suddenly her life just stopped abruptly in regards to school. Like, she hadn't seen her friends since March.
Right.
4 years old, she was in preschool. She was 4 years old then. Now she's 5. And, she couldn't do virtual learning because she couldn't sit in front of a screen for hours. She's 4. So that was very hard for her. So now she's kindergarten, and we had these dreams. Oh, she first day kindergarten, having this little happy tears. Oh my God, to get a picture. That didn't happen. And you're asking, like, what can happen for you? You see kids going to school, college, different places, and you see COVID is increasing, right? So I think it's still a study on what's going on, but you see the cases are rising. So I made the decision to get my daughter home. We're homeschooling her. But every parent doesn't have that luxury. Every parent doesn't have that luxury. They have to go to work. They have to do certain things to take care of their families. They have to put their kids in these different environments.
They got to take that risk. They have to take that risk.
And some places, like, the kids are wearing masks. They have things in place. Some kids are not wearing masks. Some kids are too young to wear masks. So the teachers are wearing full masks. So it's like every place is different. And the kids aren't part of the vaccine trials because they're too young. We don't have any children in vaccine trials right now. It's all adults. So there's no study going on for them right now. But it's you see the kids on TV, you hear about different things happening in different states, and there's still monitoring and we're still learning from these experiences. But our main goal is try to provide prevention efforts to communities to help decrease incident rates of COVID.
So we actually have something from Sister Rabina.
Oh,
I'm going to put this up right now. So her father is 98 years old. They do physical training. Never eats in it. Could that be something that be beneficial to folks in fighting COVID? Diet? Like, I eat a lot of greens. I try to eat a lot of greens.
I do too. I love eating healthy.
Is that something we may be overlooking?
That's a good question. And like I said, I'm not a doctor, so I couldn't really speak on that. I know they're trying to explore everything to see what can help with COVID, but right now there's no definition to, having healthy foods helps you protect you from COVID. There's nothing out there that says that. There's no scientific information that says that. But obviously we want to eat healthy, right? It's good with nutrients and everything, so on and so forth. But as far as fighting COVID and, as far as a way to prevent COVID, eating healthy, I'm not sure that's a way that helps prevent it, because we can go to a store, we can go somewhere and still become positive for COVID if you're not following the guidelines from the CDC and things like that.
So what do we need right now to combat COVID right now? I'm not talking about after the election. If we could have a toolbox, a COVID prevention toolbox, what do we need?
Well, we have a prevention toolbox. We can create, like I said before, like we have this toolbox where you have all information in there. But I would say what we need right now is to continue to push out prevention efforts. Keep reminding people. And also, volunteer for vaccine trials so we can help us get to a vaccine quicker. And I know folks are apprehensive sometimes about that, but we need to have a healthy sample of people that are doing this vaccine trials so we can go to every community to provide this vaccine when it's ready. And like I said, we can't do that if we only have white folks in the trials, for example. We don't know how it's going to affect Black folks if we have someone in the trials not Black. And like, if you go to the website and see about a vaccine site in your community, then you can talk to a doctor and you can answer all questions you might have. Make sure you feel comfortable. You can go back 2-3 times before you decide to enroll. And even if you do enroll and you decide you to change your mind, you can do that. You're not obligated to stay, forever. You can go in and out. But it's important to have representation of our community in the vaccine trial so that we can create a vaccine that's effective for everyone, inshallah.
So that's paramount, really, to getting a vaccine out. It has to be diversity in the trial.
We need to be diversity in the trial because we need to make sure that we can cater to everybody when it comes to vaccines. And we know everyone's not going to take it, of course, because we know our community, we're divided on this issue, but it should be available to our community so they can decide for themselves if they want to take it or not and make sure that it's effective for them. So my goal isn't to push vaccines. My goal is to provide education, and you can decide what you want to do for yourself in that regards.
Is there anything funding-wise we could do to help with the efforts with COVID?
Funding-wise? So, yeah. I don't know, like a lot of organizations have been getting out grants for COVID, right? A lot of them have done that. So I think people in their respective communities should see what's available. And if masses, for example, have funds to help communities within their community, like their brothers, sisters, their congregation, with help those who are affected by COVID, do that. Like provide, support with food, provide support with job placement or training, like help people who are affected by COVID because it is very serious. I know a lot of people who have lost a lot with COVID. Mm-hmm. I'm sure we all do. So, and also like for example, I'm in DC, right? So I'm part of this alert where I get alerts of all the grants coming out in regards to different things. And I see a lot of grants for COVID. So keeping your eye on that, going to nonprofit organizations that are doing, the work and see what they can provide you with, that can help with funding. And then me myself, I'm working with different imams and, they're going out and raising awareness about COVID in their community. So it's also helpful to their community because, they're respected leaders, right? People come to them for support and for advice. So they're talking about COVID from the khutbah, the minbar are virtually because we're in COVID, right? People hopefully are likely to respond and understand it's still very, very serious. It's something to keep in mind and be very, very aware of. So there's funding out there. Like I said, remember I mentioned earlier that the focus is all COVID now. People who are HIV positive are kind of like losing out on different things because they're pushing a lot of funding towards COVID. And, people with HIV still have HIV, still need treatment, still need so on and so forth. And, it's just like our community keeps being affected, not one way or another. And now COVID is the next thing that we're affected by. So.
Well, that's true. That's true. I just hope, that you can continue to get the support that you need. I'm going to ask you to please send whatever links that you want to send to the Shout Out Show. We'll put them on Instagram and Facebook for you, as well as any upcoming events that you may have. In fact, I know you have something with my little brother, Bashir Jones.
Yes, Councilman Bashir Jones. Inshallah, next week. So I'm starting this, like this. We're starting a series called Iman and COVID-19, Reflections from the Muslim Community. And every week from starting next week until December, we're going to have a different guest on. And we're going to have next week Councilman Bashir Jones from Cleveland. And we're going to discuss the election results, COVID, and how that's affecting us. So we're going to have a really robust discussion around that. And you can find that on my page on Facebook at, I am Khadijah.
Let me put it back up here for you.
I'm sorry, I have different handles. Instagram is different. So that's the Instagram handle, I am Khadijah, but on Facebook is I am Khadijah. So there's no A in it. And we'll have a discussion there and we'll stream it live there, inshallah, next week, Thursday, at 8 p.m. Eastern. And we're gonna have a discussion on incarceration, surviving marriage, mental health, art, racism, and COVID. So we're gonna have all the different discussions with well-known, renowned speakers, and also people from the community. It's very important to have people in the community up there talking about their experiences. So we're going to have all that, inshallah, and I invite you all to join. You can connect with me via Instagram or Facebook. I have an email as well, which is Khadijah, my first name, at havrahma.org. And we can collaborate. We can come do an event for your community virtually. Or if it's in person, it has to be strict, obviously, guidelines in place for distancing as well. But we can do that depending on what's happening in your community. Like I said, we have ambassadors across the U.S. So if I can't make it, someone else can. But we can do events for you. We talk about vaccines. I know people have questions about that. We talk about prevention efforts. Talk about, faith in COVID. So we have many things to talk about, inshallah, for your community.
Inshallah. Sister Khadijah, this was an amazing conversation. Let me thank you again for coming on the show. I know you are hecka busy. And again, because your losses before, please make dua for Sister Khadijah and her family.
Thank you. Likewise.
Appreciate you. If you don't hear anything else from me, of course you will. But and you may not have all the support that you want, but I just want you to know myself and my constituents on the Shout Out Show, you have our support. So feel free to reach out. You have my number, and I look forward to working with you in the future.
Likewise. Thank you so much. And thank you everyone for tuning in and, engaging. And even if you didn't engage, you have questions, feel free to contact me offline and hope we can talk more and talk about how we can continue the conversation after the show and within our community, inshallah.
So definitely, I would like to get a flyer and get those links so we can just send out an Instagram with people that have questions about COVID. Everything, the information is power. So I just want to make sure everybody gets that information, at least from me. All right, sister, thank you so much. God bless.
You.
Have a wonderful rest of your Saturday, and we hope to speak to you soon. Please continue the good work, and may Allah continue to bless you and guide you and keep you safe and healthy. Please give my salams to your family.
Likewise. Assalamu alaikum.
All right, famos. That's the end of the show. Again, a hearty thank you to Sister Khadijah Abdullah, who came in and just dropped all kinds of gems about this whole thing that we're calling COVID, and also reminding us that there are other things out there that need attention too, mainly HIV/AIDS. We need to be paying attention to that too. Don't take your eyes off the prize. So I'm going to get out of here because I'm old and I'm tired, but I feel uplifted. And again, brothers and sisters, take this information that you heard, share with the other folks. I'll be back with you on Potluck Sunday with Preacher Moss. Have a blessed day. Assalamu alaikum wa rahmatullahi wa barakatuh.
Hey everybody, this is your brother Preacher Moss. Listen, I hope that you enjoyed your Shout Out Show experience. We'll be back with the next show, the next Shout Out Show. Simple ask before you go, please help your brother out. Click that subscribe button, click that notify button, and I'll see you again on this side of the microphone. You probably wonder what that smell is. That's me. I smell good. And the reason I smell good is because I use oils from Tarifa Tar. So I'm not saying you can't smell good. I'm not even saying you stink. I'm saying you have the opportunity to smell exquisite. Check out tarifatar.com for some of the best oils and scents in town.